Chickenpox, also called shingles, chickenpox produces a red rash that blisters and crusts over. It is highly contagious and spreads through body fluids and physical contact. You can prevent chickenpox with a vaccine. What are the 3 stages of chickenpox? The 3 stages of chickenpox typically indicate the appearance of a rash. Stage 1 is a red, bumpy rash. This may last for several days. Stage 2 is a rash with fluid-filled blisters. The blisters will burst in about 1 to 2 days. Stage 3 is when the blisters become covered with scabs. This stage also lasts for several days. Even though the rash goes through 3 stages, all types of bumps may appear at the same time. This means that some bumps may form while others are already open. The entire rash may last up to about 10 days. Causes of chickenpox. The virus causes chickenpox. The virus spreads when an infected person passes it to another person through bodily fluids, coughing, sneezing, etc., or physical contact, touching the rash. Symptoms of chickenpox. Chickenpox symptoms are easy to see. Your healthcare provider can often tell if your child has chickenpox by looking at his or her skin. Symptoms of chickenpox typically occur in the following order: low-grade fever, tired, headache, my stomach hurts so much that I don't want to eat. It is a skin rash that is very itchy and looks like many small blisters. Bumps filled with liquid that looks like milky water. After the blisters burst, a scab forms. Mottled-looking skin and hard spots that disappear. Children who have been vaccinated against chickenpox are generally protected from getting chickenpox. However, vaccines are not 100% effective, and some children may develop a breakthrough infection despite being vaccinated. The good news is that these breakthrough infections are usually very mild. Chickenpox treatment. Make sure your child gets plenty of rest and fluids. Chickenpox goes away on its own within 1 to 2 weeks. To help your child feel less itchy, apply pressure to the rash area with a cool, moist cloth. Keep your child cool. Encourage your child to avoid scratching. Trim your nails to avoid scratching them. Apply lotion containing an antihistamine to the rash. You can buy this lotion at the pharmacy. If you don't know what to buy, ask your pharmacist for help. Give your child an over-the-counter, OTC, antihistamine. Diphenhydramine, Benadryl, and cetirizine, Zyrtec, are 2 examples of OTC antihistamines. Give your child a cool bath or shower every day. You can also give your child an oatmeal bath. Do not rub with a towel when drying. Instead, pat your child dry. Give your child plenty of water and fluids to prevent dehydration. If you have blisters in your mouth, a bland diet may help. Do not give your child aspirin. Aspirin may harm children who have a fever. If your child needs pain medication, use acetaminophen, such as Tylenol. If you are not sure which product to use, ask your child's healthcare provider. How is chickenpox spread? Children can get chickenpox at any age. After exposure to chickenpox, your child may seem fine for 1 to 3 weeks before becoming sick. Children can spread the virus 1 to 2 days before showing signs of illness, until all blisters harden or crust over. Chickenpox spreads in the following ways. If you come into contact with someone who has chickenpox, you breathe in the air of an infected person who sneezes or coughs. Contact with body fluids from the eyes, nose, or mouth of an infected child. Where does chickenpox usually start? Chickenpox usually starts to appear on the face and torso, chest and back. From there it spreads to the rest of the body, including the fingers and toes. At what age do you get chickenpox? Now that a vaccine has been developed to prevent chickenpox, most children in the United States do not get chickenpox. However, for unvaccinated people, it is more common to receive the vaccine between the ages of 3 and 6. Why is chickenpox rare now? Chickenpox is not as common as it used to be because the chickenpox vaccine has greatly reduced the number of cases. Can chickenpox be fatal? It is very unlikely that you will die from chickenpox. Most people recover without complications. Most people who die from chickenpox are adults. In 2022, chickenpox caused fewer than 30 deaths and fewer than 1,400 hospitalizations in the United States. What is the treatment for adults with chickenpox? Treatment for adults is the same as for children. However, your healthcare provider may recommend antiviral medications. Adults who are at risk for severe symptoms or who have certain medical conditions may benefit from taking antiviral medications. How long is chickenpox contagious? Chickenpox is contagious until all the bumps on the body crust over. Even if you have a fluid-filled blister that hasn't broken or crusted over, you can still spread the virus. How long does it take to recover from chickenpox? Chickenpox usually goes away in 10 to 14 days.